Welcome to the deep dive. There's quiet revolution reshaping healthcare, especially in India.
hmm
It's not necessarily about building brand new hospitals everywhere, but more a powerful strategic shift within the system. We're talking about this breaking away phenomenon where single specialty hospitals are carving out a distinct and, well, incredibly successful path.
And when we say successful, it really is a dramatic story unfolding in the numbers. Just to give you some context, single specialty hospitals accounted for about 20% of the Indian private healthcare market revenue back in 2019.
Okay, about a fifth.
Right. Now, jump forward to 2024, and that share has surged to 30%,
Wow.
which translates to a massive $15 billion. And the projections, they're even more impressive. By 2028, it's expected to hit 40% of the entire market,
40%.
reaching an incredible $31 billion. And this isn't just, a temporary blip. It's consistent, robust growth. We're seeing a compound annual growth rate, a CAGR, of around 19–20%. Pretty steady.
That consistent growth, that 19–20% CAGR, is exactly why we're taking a deep dive into this today. Our mission here is to unpack the macro forces and the micro drivers fueling this surge. We want to discover what makes certain medical specialties just ideal for this focused model, and then look at the significant investment trends shaping the future. So by the end of this, you'll have a real shortcut to understanding this rapid transformation in healthcare.
Okay, so to set the stage, let's just quickly look at India's broader healthcare landscape. In 2024, the entire Indian healthcare market was estimated at about $130 billion.
Huge numbers.
Huge. And hospitals make up the biggest chunk of that pie, roughly 59%. And within the hospital market itself, it's the private and trust hospitals that dominate. They hold about 67% of the market share.
So a massive and growing pie, and it sounds like private players are really driving the engine here. What are the big factors then? The powerful tailwinds pushing this specific slice, the single specialty growth?
Yeah, there are definitely several powerful forces at play. First, you've got significant lifestyle shifts. We're seeing, more sedentary living, changing diets, rising stress levels.
Usual suspects.
Exactly. And it's all contributing to a huge increase in non-communicable diseases. Things like diabetes, hypertension, obesity. This naturally drives a need for more specialized care.
So more specific health challenges demand more focused solutions. That makes sense. What about demographic shifts? India is known as a young country, but that's changing, isn't it?
It is, yeah. India's demographic shifts include a rising median age and, importantly, a growing population over 60. Older populations just inevitably require more health care, often for chronic conditions, and those really benefit from specialized management.
Okay.
Then there's affordability and accessibility. As disposable incomes rise and urbanization continues, well, quality healthcare becomes more accessible to more people. And awareness about different treatments also goes up.
Right. And we can't forget India's growing reputation as a medical tourism destination, can we? That must play a role.
Absolutely, that's a definite contributor. People are increasingly looking to India for cost-effective but also advanced healthcare. And crucially, there's just immense headroom for growth. India's healthcare spending is still quite low overall, only about 3.3% of GDP compared to a global average of, around 11%.
Ah, big difference.
Yeah. So that signals this vast untapped potential for future expansion, both for general and specialized care.
Okay, so here's where it gets really interesting for me. With all those tailwinds pushing the whole sector, why are these focused, single specialty hospitals seemingly outperforming? What's their competitive edge over the traditional multi-specialty giants?
That's the key question, right? And what's really insightful is their inherent strategic advantage. Think about targeted innovation. A multi-specialty hospital might invest in broad use equipment, serves lots of departments.
Right, general purpose.
Exactly. But a single specialty center, they can invest in highly specialized cutting-edge equipment that's precisely tailored for their specific patient needs. They're not trying to be everything to everyone. They're mastering one thing.
So it's like a laser focus that allows for deeper specialization. That sounds like it would also lead to much better optimized unit economics.
Precisely. Focusing on just one set of ailments dramatically lowers both capital expenditure CapEx and operational expenditure OpEx per center. They can implement really rigorous standard operating procedures, SOPs, and achieve true economies of scale.
How so?
Through high-volume procurement of specific machines, consumables, you name it. It's just a leaner, more efficient machine.
And efficiency, that often directly translates to scalability, which has got to be huge for expanding quickly in a market as vast as India.
Oh, it's a cornerstone of their
Yeah.
success. Their lower capex intensity, their streamlined operations, the customizable capacity planning,
Mm.
it all makes them incredibly scalable. They can essentially replicate their model much more easily and quickly than a huge, complex, multi-specialty hospital can.
Makes sense.
And there's another point, doctor focus. These centers specifically attract specialists who can truly focus on clinical work. They have far less administrative distraction compared to a big hospital setting.
Right, less bureaucracy.
Exactly.
Yeah.
This enhances doctor focus, elevates clinical expertise.
Mm.
It's a win-win for doctors and patients.
And for patients, I imagine it often means better proximity and experience, getting that high-quality branded care closer to home, maybe feeling less like a number.
That's exactly it. They improve access by being physically closer. And because everything is geared towards one specific condition, they can offer a highly customized patient experience. Turnaround times are often significantly lower, too.
Okay, but this raises a critical question then. What makes a specialty particularly ripe for this breakout recipe? Because surely not all medical fields are equally suited for this model.
That's a really critical point. It's definitely not a one-size-fits-all approach.
So what does the data suggest? What are the key criteria for a specialty to really succeed in this focused way?
From what we've seen, 4 key factors seem to stand out. First, low interdisciplinary dependencies, meaning they don't heavily rely on lots of other medical fields for their core patient care. It's relatively self-contained.
Okay, less complex coordination.
Right. Second, high specificity of indication or symptoms. So patients generally know exactly what kind of specialist they need. That simplifies the pathway.
Got it. They self-select almost.
Sort of, yeah. Third, specific infrastructure and equipment needs. Needs that can be precisely tailored and optimized just for that specialty. And finally, generally lower capital expenditure intensity compared to setting up, a sprawling multi-specialty hospital.
So less upfront investment needed per center.
Exactly. It's not just about being efficient. It's about identifying conditions that are self-contained enough to be treated almost like a specialized production line.
Like a microfactory for healthcare. That's a powerful analogy.
It kind of fits, doesn't it?
Right.
Rather than a sprawling, complex medical campus.
Right.
That's the core idea behind the breakout recipe, finding these medical niches that can operate like highly efficient businesses.
Okay, that really clarifies the how and the why. So we've laid the groundwork. Now let's really bring it to life by looking at the sheer business power of these single specialty hospitals. Because the numbers, like you said at the start, they tell a huge story.
They absolutely do. Let's just walk through the total addressable market, the TAM, for some of these key specialties. It just gives you a sense of scale. For IVF, in vitro fertilization, we're talking about a market that's basically set to nearly double in just 4 years.
Double.
Yeah, from around 0.80, 0.9 billion today, projected to 1.4, 1.7 billion by 2028, still maintaining that high 17% CAGR.
Okay. What about Eyecare?
Eyecare is also projected for strong growth, from about 3.8, 4.6 billion now up to 6.0, 7.2 billion. That's a 14% CAGR, still very healthy.
And mother and child care, you mentioned that's even larger.
It is. Projected to grow from 5.0, 5.2 billion today to 8.4, 8.5 billion by 2028. Also a robust 14% CAGR.
Okay.
Then you've got dialysis, expected to more than double from about $0.6, $0.7 billion now to $1.2, $1.3 billion. Again, a strong 17% CAGR there.
And oncology. Cancer care is critical.
Oncology, yes, a massive and critical segment, growing from $2.5, $2.6 billion currently to $3.1, $3.2 billion by 2028. It's about a 13% CAGR. And what's really compelling is that even the sort of emerging specialties,
Like which ones?
things like dental, urology, nephrology, skin and hair care, they're all showing strong growth, too, around 17% CAGR, even though they're starting from a lower base.
So it's really quite broad-based, this trend.
It really shows how pervasive this single specialty model is becoming.
And these aren't just growing markets, they're creating leaders of scale with incredibly attractive economics. You mentioned profitability. What kind of numbers are we talking about?
Well, the leaders in these segments are already capturing over 20% of the organized market, which is significant. And their profitability is quite impressive. These centers typically achieve attractive EBITDA margins.
Right. Earnings before interest, taxes, depreciation, amortization. A good measure of core profitability.
Exactly. Often 20% or even more. And some, like IVF, can see a truly remarkable 100% plus return on capital employed ROCE at the mature center level.
Whoa, hang on. Over 100% ROCE. Can you unpack that? What does that actually mean for an investor or an operator?
It means that for every single dollar they've invested in building and equipping that mature center, they're generating over $1 in operating profit from that capital each year.
That's incredible efficiency.
It's incredibly efficient. It's largely because they're hyper-focused, optimizing every single resource for just one purpose. To give you a concrete example, an IVF center might only require about $0.4 to $0.5 million in capex to set up.
Relatively low.
Right. But it can generate $1.4 to $1.5 million in revenue per year once it's running smoothly. And the most striking part, they often break even, start making profit in just 4 to 6 months.
4 to 6 months. That's almost unheard of in healthcare facility terms.
It really is unparalleled efficiency.
So that level of scalability and efficiency must be a huge draw. Does this streamlined model make them inherently more appealing to, say, private equity investors compared to traditional, more complex hospital groups?
Oh, absolutely. This kind of efficiency makes them a real investment magnet. You see these players investing heavily in brand recognition, almost like consumer retail businesses.
Building trust?
Exactly. Building trust and reputation. And mergers and acquisitions, M&A, become a highly viable growth strategy, a roll-up strategy.
Right, buying up smaller players.
Precisely. We've seen examples like Nova IVF acquiring Wings IVF, or Dr. Agarwal's Eyecare acquiring over 50 centers just since 2022. This roll-up strategy is very attractive to investors looking for rapid expansion and market consolidation.
So not just organic growth, but strategic consolidation. And the private equity numbers you mentioned earlier really underscore this confidence, don't they?
They really do. Single specialty hospitals attracted about 36% of total hospital investments in the last decade. And that share is actually increasing recently. Even more telling, over 70% of all healthcare service investments in the last decade specifically flowed into just 3 areas: IVF, Oncology, and Eyecare.
70% into just those 3.
Yeah. And looking ahead, the market capitalization of the listed single specialty hospitals is projected to reach $18 billion by FY30.
Up from...
Up from just $4 billion in March 2025.
Wow. That signals massive confidence in the sector's future.
Huge confidence.
Okay, so we've covered the why the drivers and the how, the business model and economics. Now let's dive into the specifics. Let's look at some of these established specialties you mentioned. IVF, Eyecare, mother and child, dialysis, oncology. Let's start with IVF, the hope multiplier. What's the specific market context there in India?
Right, IVF. Yeah. So India is actually one of the least penetrated IVF markets globally. There's huge unmet need. Yet, it also boasts one of the cheapest treatment costs, maybe around $2,500 per cycle. Compare that to the U.S., where it could be $23,000 or more.
Massive difference.
Huge. And despite that low penetration, India has a high infertility prevalence, maybe 18–19%, driven by various lifestyle and clinical factors. So the underlying need is immense.
So high demand, growing acceptance, relatively low cost. What else is fueling the growth specifically in the IVF segment?
Well, beyond affordability, it's primarily driven by increasing awareness, just people knowing it's an option. Also, rapid urbanization and a growing societal acceptance of fertility treatments. They're becoming much more mainstream. The market, as we said, is projected to hit $1.4 to $1.7 billion by 2028, with the number of IVF cycles potentially reaching 550,000 annually. And what's truly fascinating are the tech innovations pushing this forward. We're seeing things like robotics-assisted sperm injection, laser-assisted hatching, also vitrification for egg freezing that's becoming quite popular, especially for career-focused women wanting to delay childbirth.
Right, elective freezing.
Exactly. Plus, AI and machine learning are being used for embryo selection, for sperm analysis, and there's even increasingly sophisticated wearable fertility tech coming onto the market.
That's quite a leap in technology. Is there a regulatory angle here as well? Is that shaping the market?
Yes, definitely. The RT Act of 2021 is crucial. That's India's Assisted Reproductive Technology Act. It's designed to standardize practices across the board, curb unethical activities, and basically bring more structure and trust to the whole sector, make it more organized.
Okay, so standardization and trust. What's the overall outlook for IVF then?
We expect continued PE-led consolidation, more mergers and acquisitions and expansion, particularly into Tier 2 cities where services are less available. Affordability will obviously remain a key factor, as most treatments in India are self-funded, not covered by insurance. That's a hurdle.
Got it. Okay, let's shift gears to eye care. Clear vision for growth. You mentioned India has one of the highest numbers of visual impairment cases globally. Why is that so prevalent?
Yeah, it's a major issue. And a huge reason is preventable causes, primarily untreated cataracts, shockingly. They account for about 66% of blindness in India.
66% from cataracts alone.
Yes, largely treatable. Other significant factors include India's growing geriatric population, high sunlight exposure in many parts of the country. Also, a rising number of diabetic patients. Diabetes, as you know, can cause serious vision problems like diabetic retinopathy.
Right.
And of course, increased screen time, especially among younger people, leading to a rise in myopia or nearsightedness.
So, a significant and unfortunately growing patient pool. What kind of growth are we expecting? And are new technologies making a difference here too?
Well, just cataract volumes alone are expected to reach something like 17 to 19 million procedures annually by 2028, just to give you an idea of the scale.
Incredible volume.
Huge. And on the tech front, yes, lots of advances. We're seeing advanced LASIK surgeries, things like wavefront-guided, femtosecond LASIK, contour vision. There's also zeptocataract surgery and the SMILE procedure for vision correction. These are really transforming treatments, improving outcomes and recovery times.
And for scalability in eye care, you mentioned the hub and spoke model earlier. How does that work exactly?
Yeah, it's proving incredibly effective for eye care chains. Imagine a central, highly equipped hub hospital. This is where they do the complex surgeries, have the advanced diagnostic capabilities.
The main center.
Right. And this hub is then supported by several smaller, more accessible spoke clinics spread throughout a region or city. These spokes handle the basic consultations, the preoperative checks, postoperative follow-ups, essentially extending the reach of quality care much closer to where patients live.
Without needing full hospitals everywhere. Smart.
Exactly. It maximizes reach and efficiency.
So what's the outlook for specialized eye care chains?
With increasing affordability, partly thanks to government schemes like Ayushman Bharat, which helps cover costs for many, patients are expected to increasingly prefer these single specialty chains over, say, general hospitals for eye issues. We think their market share could rise to maybe 22–25% in the next 4 or 5 years.
Significant share? Any risks?
The main potential risk is around pricing. Potential government pricing caps on high-volume procedures like cataracts could impact margins, so that's something players need to navigate carefully.
Okay, that makes sense. Moving on to mother and child care. Nurturing a niche. You said India has a unique profile here. What's the context?
It does. You have this very large target group, millions of women in reproductive age. But historically, India had lower rates of institutional deliveries compared to developed nations.
Meaning more home births?
Yes, particularly in rural areas. And unfortunately, that contributed to higher maternal and neonatal mortality rates. That's been improving, but it's the starting context.
So a massive yet historically underserved market in some ways. What's fueling the growth now for the single specialty players stepping into this space?
Well, firstly, you still have a very large number of women in the reproductive age group. And critically, there's been a significant rise in institutional births, people choosing hospitals or clinics.
Okay, shift towards formal facilities.
Exactly. That expands the addressable market dramatically. Plus, there's a rising demand for specialized neonatal care and ICUs due to increasing pregnancy complexities and just a greater focus on infant health and survival. These chains are also smart about adjacencies. They're extending their services into related areas like fertility treatments, pediatrics, general gynecology, aiming to be a comprehensive, one-stop solution for women and families. Covers more of the life cycle.
That sounds like a strong strategy for building long-term patient loyalty. What's their competitive edge against the broader multi-specialty hospitals who also offer maternity services?
They typically offer very comprehensive care packages, often with more advanced equipment specifically for obstetrics and neonatology. They have highly specialized doctor teams, OBGYNs, pediatricians, neonatologists, all focus solely on mother and child health. And they often cultivate a more premium, family-friendly experience, which might not be the top priority for a large, busy multi-specialty hospital.
Right, the ambience and focus differ.
Exactly. For the outlook, while the absolute number of births in India is projected to decline slightly due to falling fertility rates, the share of births happening in private institutions, especially these specialized chains, is expected to increase significantly. Why? Better perceived quality, value-added services.
Okay, any challenges?
It does remain a fairly localized business model. Patients often prefer proximity for maternity care, and multi-specialty hospitals with established reputations are still a strong competitive threat.
Got it. Next, established specialty. Dialysis, the lifeline expansion. You mentioned India faces a massive challenge with kidney disease.
It's a huge and growing problem. India currently has the second highest prevalence of chronic and acute kidney disease globally. and it's actually expected to surpass China in the next 5 years or so.
Wow. Why such high rates?
The main drivers are those lifestyle diseases again.
Huh.
Diabetes and hypertension are major risk factors for kidney failure, and their prevalence is rising rapidly in India. That directly feeds the need for dialysis.
So a massive growing need. What's specifically driving the growth for these specialized dialysis service providers?
Several things. One is simply improved access, more centers opening up. Another is changing patient preferences, people actively seeking out higher quality, more reliable care. And expanding government scheme coverage, like the Pradhan Mantri National Dialysis Program, PMNDP, helps make it more affordable for many.
Interesting. Any international angle here?
Yes, actually. Indian dialysis players are quite strategically positioned to expand into adjacent regions. Think Southeast Asia, the Gulf Cooperation Council countries. There's a large and growing market for dialysis services there too,
Yeah.
often with similar underlying causes.
Okay. Are there tech advancements happening in dialysis, or is it mostly about expanding access to the standard treatment?
No, there are definitely advancements. We're seeing innovations like nanotechnology being used for dialysate fluid purification, making the process safer and more efficient. And there's a big push towards developing portable or even wearable dialysis machines. Fresenius has one called Next Stage 1, for example.
Wearable dialysis, that would be life-changing.
Absolutely. Improving convenience and patient quality of life is a major goal. There's also hemodiafiltration, a more advanced filtering technique gaining traction. The outlook suggests traditional hemodialysis in centers will remain primary for a while, but there's a definite global push towards home dialysis.
Makes sense for patient convenience.
It does. But adoption in India faces challenges: cost, reliable power, trained staff availability for home settings. Overall, though, the organized chains are expected to significantly increase their market share, maybe up to around 30% in the medium term, partly driven by public-private partnership, PPP models, with the government.
Right, partnering to expand reach. Okay, finally, in our established specialties, let's talk about oncology. Battling cancer with focus, a critical and incredibly complex area.
It really is. And India faces this tough dual challenge: a high incidence of cancer overall, coupled with late-stage detection for many major types like head and neck cancers, breast cancer.
So diagnosis often happens when it's harder to treat.
Exactly. And there's also a significant demand-supply gap. Not enough oncologists, not enough specialized cancer centers, especially outside the major cities. This means many patients in Tier 2 cities and rural areas still have to travel long distances, often at great expense and difficulty, for treatment.
What factors are unfortunately driving the increasing incidence of cancer in India?
It's a mix of factors. A large tobacco and alcohol user base is a major contributor, particularly for head, neck, and lung cancers. Increasing exposure to pollution, both air and water, is another factor.
Yeah.
And rising obesity rates are linked to several types of cancer as well.
Okay. On the treatment side, what's happening on the technological frontier in oncology?
There's a lot happening. We're seeing advanced therapies like CAR T cell therapy starting to become available, though still very expensive.
Right, the personalized immunotherapy.
Yes. And huge advancements in precision radiation technologies, things like proton therapy, gamma knife, cyber knife, allowing for more targeted treatment with fewer side effects, molecular imaging for better diagnosis and staging, and the use of AI for early detection and developing personalized treatment plans are also playing increasingly significant roles.
So how are these single specialty oncology chains approaching such comprehensive and sensitive care? What's their model?
They're really adopting a comprehensive care model, offering surgical oncology, medical oncology, chemotherapy, immunotherapy, and radiation oncology, all under one roof. This positions them as integrated go-to centers for high-quality, consistent cancer treatment. It provides that continuity of care that's so crucial for cancer patients.
Makes sense. The outlook.
The overall oncology market is projected to grow to about 5.3 billion by 2028. There are significant expansion opportunities, especially in Tier 2 plus towns, often through consolidating smaller existing facilities. A key challenge, though, remains affordability. Novel therapies like CAR-T, while revolutionary, are largely unaffordable for the vast majority due to limited insurance coverage for such high-cost treatments in India.
A critical point. Okay, we've covered a lot of ground on the established players, the ones really leading this charge right now. But what about the emerging specialties? Where might we see the next wave in this breaking away phenomenon?
Yeah, the sources highlight a few interesting ones, and one that might surprise some people is dental care, a hidden giant.
Dental, interesting. What does that cover?
Well, it's actually quite comprehensive. The key focus areas include orthodontia, braces, Endodontia, root canals, oral surgery, periodontal gum disease, pedodontia, children's dentistry, implantology, general dentistry, and prosthodontia, crowns, bridges, dentures, a whole range.
Okay, pretty broad. And you said India has a unique challenge here too. It's not just about cavities, is it?
Not at all. India actually has one of the highest incidences of dental disorders globally. Get this, oral diseases contribute billions more cases than the next 5 non-communicable diseases combined.
Billions. That's hard to fathom.
It's staggering. But despite this huge burden, India has one of the lowest numbers of dentists per 10,000 population, only about 2.0,
Compared to.
compared to, say, 6.6 in the broader Southeast Asia region.
Wow, so a massive demand-supply gap.
An enormous gap, just waiting to be filled by organized, specialized players who can offer consistent, quality care.
That statistic really paints a picture. So what's the projected growth for organized dental care in India, given that huge potential?
The market for organized dental care is projected to roughly double grow from about $0.6 billion in 2024 to $1.1 billion by 2028. Again, showing that strong 17% CGR that we've seen in some of the other emerging high potential segments.
Okay, so dental is definitely one to watch. Any others?
Yes, the analysis also points to other emerging specialties like urology, nephrology, beyond just dialysis, and skin and hair care, showing similar impressive growth trajectories. Each around that 17% CGR mark, it really signals where the next wave of specialized healthcare investment and development could be heading in India.
That was truly a deep dive into this breaking away phenomenon in Indian healthcare. We've really seen how single specialty care has not just, come of age,
Yeah.
but is actively and rapidly transforming the entire healthcare landscape, driven by that focused expertise, those smart business models, and clearly significant investment. It feels like a real strategic evolution, doesn't it? Almost a maturing of specialized care, challenging some of those older assumptions about how healthcare has to be delivered.
It really is. And I think the big picture for you, the listener, is this clear and powerful shift towards more specialized, more patient-centric care. This model inherently prioritizes specific outcomes and specific patient experiences, moving away, in many cases, from that generalist multi-specialty approach for certain conditions.
Right.
It's really about optimizing care for a particular need, and in doing so, delivering efficiency and, ideally, quality in a way that was harder before.
So let's end with a provocative thought then. What does this all mean for the future of healthcare, not just in India, but maybe globally? As technology keeps advancing, as patient expectations continue to evolve, could we see a future where highly specialized, almost boutique healthcare becomes much more the norm? Could it potentially challenge the traditional multi-specialty hospital model even further? Or maybe lead to, I don't know, unique hybrid approaches we haven't even seen yet?
It's a fascinating question.
This whole shift really highlights the crucial role of focused expertise in a world that's grappling with increasingly complex, often chronic health challenges. Something to definitely keep an eye on.